Ever wondered what your doctors means when they say your blood pressure is 120 over 80? Let's break it down. Your heart is an amazing pump. With each beat, the left ventricle contracts, pushing blood into your arteries. These arteries expand to receive the blood, and their muscle wall push back, squeezing the blood into smaller vessels throughout your body. Blood pressure is simply the force of this blood pushing against the artery walls. There are two numbers. The top number, called systolic pressure, is the peak pressure when your heart contracts. The bottom number, diastolic pressure, is the pressure when your heart relaxes between beats. So 120 over 80 means a systolic pressure of 120 and diastolic of 80. This is a healthy reading for a young adult. But blood pressure isn't static. It naturally rises with age as arteries become less flexible. Stress, exercise, and certain diseases can also cause temporary spikes. When it stays constantly high, that's called hypertension. High blood pressure can lead to serious problems like heart failure, stroke, or kidney diseases. On the flip side, abnormally low blood pressure is also dangerous, as it can starve your brain and organ of oxygen. So, what's new in the world of blood pressure? The game is changing. Recent guidelines are pushing for lower treatment targets, aiming for a systolic pressure around 120 to 129 for many people on medication. This is because major studies show that tighter control leads to fewer heart attacks and strokes. However, doctors are also urged to be flexible, especially with older or frail patients. A huge shift is the focus on measuring blood pressure outside the doctor office. Using a validated home monitor or a 24-hour ambulatory monitor is now strongly recommended to confirm a diagnosis. This helps avoid misdiagnosis, white coat hypertension, where your pressure is only high at the clinic, or catching masked hypertension, where it's normal at the clinic but high at home. For those with stubborn, hard to treat high blood pressure, exciting new treatments are on the horizon. One is renal denervation, a procedure that uses energy to calm overactive nerves in the kidney arteries, which can help lower pressure. We are also seeing promising new drugs like aldosterone targeting agents, which have shown great results in late stage trial for resistant hypertension. These could be game changers for patients who haven't had success with other medications. And what about all those new wearable gadgets that promise to track your blood pressure? While the technology is developing fast, cuffless devices and smartphone apps are not yet accurate enough for making clinical decisions. For now, a validated upper arm cuff monitor is still the gold standard for home use. The key takeaway is to be proactive. Always confirm high reading from the doctor's office with at-home measurements. Talk to your doctor about your personal blood pressure target and remember, lifestyle is a key. A healthy diet, regular exercise, and reducing salt remain the foundation of good blood pressure management. Thanks for watching. If you found this helpful, please like and subscribe for more health insight.